Hey, this is Russ. Today we are celebrating Tony Maritato's 5,000, actually he broke 5,000, 5,000 subscribership, okay, on his YouTube channel called Total Therapy Solution. I highly recommend you guys go take a look at his channel. And what we decided to do is I'm doing an interview of Tony today on my channel here, and Tony did an interview of me on his channel. So when you're done watching him here, go over to his channel and you can watch me. Yeah, we talk about different things, so it's not the same thing, okay? Anyways, thank you so much to Tony for this, and without any further ado, here's Tony. Hey, Tony, how you doing?
Hey, Russ, I'm doing great.
Hey, it's interesting that we both have YouTube channels. I'm a patient and you're a therapist. And, I watch your channel and I want my viewers to watch it too, because I think they can benefit a lot. So let you introduce yourself, your name, your channel name. Let people know. Go ahead.
Sure. So my name is Anthony Maritato. I am a licensed physical therapist here in Ohio. The name of the YouTube channel is Total Therapy Solutions. I'm a general orthopedic physical therapist. I treat everything from hips, knees, back, elbow. But lately, I've been in the business about 20 years. And over the last 10 or so, I've really kind of focused in on total knee replacement.
Okay.
And the reason why is I just felt that, you know, there's 800 plus thousand knee replacements a year going on. The patients that are coming into my clinic are frustrated, they're upset, they're anxious. And I felt that they needed something a little different than the standard total knee replacement rehab.
Okay.
And so that kind of brought me into, let's talk about other things beyond the physical. Let's talk about the emotional support, the mental. Let's talk about the challenges related to sleep and nutrition and so many of these other things. And so I started my private practice. It was my wife. She was the physical therapist. I was a strength coach and personal trainer. This was back in 2001 down in Sarasota, Florida. We moved to Ohio in 2006. We got married. We have 4 beautiful boys. And this is what I do. And then I started my YouTube channel to share these experiences because I knew that there were so many people who didn't know what was going on in other physical therapy clinics. So
Right.
I wanted them to be able to see, hey, this is what this guy's doing. Maybe you like it, maybe you don't. But it just gave that person sitting at home a chance to be a fly on the wall and peek inside the window to somebody else's experience.
Yeah, that's actually interesting because you mentioned, about the emotional aspects of things, and nobody ever talks about that. You can see your doctor, you can see another therapist. They don't have time to talk about it. I guess,
Yeah.
they've got an hour or whatever length of time they have with you, and they're going to work your knee, and then you're out of there. So, but we go through so much more than just the knee. I mean, the depression, the sleepless nights, all that kind of stuff is part of the whole knee journey, I think. you know so I'm glad to hear that you do that, and maybe even for yourself. I don't know if you have the time even during your sessions with them, but at least you can refer your patients to, hey, watch the YouTube channel, because we do talk about that kind of stuff. So it's good to have that resource out there.
It is. And that was a big part of it too. When I first started, I would say that so much of it was I think, I don't know if you shared them. You remember those little stick drawings of people and therapists would give you that and say, this is your home exercise program. This is what I want you to do. And I was like, why are we still giving stick drawings when we have technology and incredible resources?
Yeah.
So I would, and I just did it today. I'll record the video of the individual doing the exercise. If they don't want it public, I just text it to their phone. But, the YouTube channel gave me an outlet to say, look, this is the stuff. This is what good therapy, what I would consider good therapy, should be.
Mhm.
These are the conversations that your therapist should be having. These are the things that your therapist should be doing. And I try to have a combination of some exercise so you can see what's going on in the clinic, but then also just some context, giving people the reassurance that it's okay to take a break. I was talking to a patient today and she's been literally working on her knee every single day. And I'm like, you need to relax. You need to stop. You need to let your body recover. If you were an Olympic athlete, you couldn't train at a maximum intensity 7 days a week. You train so you can rest and recover and then train again. And I think we fall into this mindset. We're so fearful that the scar tissue is going to build up, that I'm going to lose strength, I'm going to lose range. I have to push, 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 push. And in reality, I think most of my patients could probably do 20% of what they actually do,
Right.
and they would be just fine.
Right.
Give the body time to heal, give it time to recover. There's a time to push yourself, but it's not every single day.
It's interesting that you bring this up because I had a video not too long ago where I had never spoken about this until that video just recently, that I actually did take a break. I took a break right in the beginning of this year because my insurance company had shifted to a different authorization firm, and it took them 2 weeks before they finally reauthorized me for more physical therapy sessions. So that 2 weeks time, I wasn't being pushed, I wasn't doing anything. But I think that 2 weeks gave me a little bit of recovery time because the knee wasn't being stressed so much.
Right.
It looked less puffy, and then I got more range afterwards too. So I said, maybe a little bit of time away isn't such a bad thing. And I didn't know how the therapists or how the doctors felt about that. And I mentioned that too. I said, I don't know how these guys think about it, but for me personally, it made a big difference just to take a little bit of breather.
Yeah, it does. And I mean, I think context, so as an individual, I'm 45 years old. I've been in this business 20 years. Before this, I was a strength coach, like I mentioned. The human body is the human body. Your knee, my knee, a 20-year-old knee, there's certain principles that we follow. And so when you look at periodization from an athletic performance perspective, you understand there's work cycles and rest cycles.
Right.
There's times to overload and times to recover. And we know that the harder we push a muscle, a bone, a joint, a ligament, the longer the recovery time, and so I always tell my patients, I'm like, look, the first 2 weeks after surgery, I don't care if you do nothing. I don't care if you see me get up to go to the bathroom, get up to move around, let your body recover from the trauma of surgery. And then from weeks 3 to week 6, we can start to pay attention to the motion and pay attention to, range and flexion and extension and things like that.
Mm-hmm.
And then from week 7 to about week 12, we can start to get back to a normal life and start to walk and start to do things. I'm not even worried, truthfully, about strength and function until like 26 weeks. If I had the ideal scenario and I didn't have to worry about cost and I didn't have to worry about insurance, I didn't have to worry about anything, this would be a 12 to 36 month endeavor, because it really is something of that nature. It really is. It's a commitment that's going to affect and influence everything in your life.
Right.
It's not an outpatient procedure, even though it's done on an outpatient basis.
Right.
It's something that's going to influence you for the next several years. So let's take it slow.
So it's not something that really, we read about people finishing in 2 to 3 months and they're back to normal. It is a longer term than they were led to believe.
It is. I think obviously those cases do exist, and
Right.
I don't want to discount it at all. But if you had a distribution and you had a bell curve, and even if you look at some of the stats, I mean, 20% of the people that have had this procedure never are pain-free. And many of those have a different pain, but worse pain than they had before surgery. 20% is a huge number.
Wow.
So when we look, and I'm not a statistician, but when we look at the bell curve, I mean, the reality is there's going to be a huge chunk in the middle that are looking at 6 to 12 months, and many of us, unfortunately, prior to surgery, we weren't like Olympic athletes. We weren't able to walk and jog and run and do all of these things. We were already less healthy than we want to be. So it's a full lifestyle shift. It really is. It's how do I eat better? How do I sleep better? How do I, find purpose in my life and bring community together and have the family support structure and have something else, whether it's a job or something outside of me, that I can really kind of shift my focus from, okay, I know my knee hurts today. I know it's throbbing, but I need to get up because if I don't, my puppy's not going to eat.
Right.
Right. And you have those external drivers that keep you moving.
Yeah, that's good to hear that from you because nobody really talks about this kind of stuff. They only
Yeah.
talk about, okay, the physical need. This is the stuff you have to deal with, but we go through a lot more than just the knee.
Well, I'll tell you, because it's easy to just think of the mechanics. It's easy to look at you, Russ, as a robot and pretend that your knee is a hinge joint, because that's the way it's classified, and pretend that you just have these muscles that are elastic bands and, forget about all the rest. But you can't. Like, you're a human being. You have a history. There's stuff that has gone on in your life that has created and colors your experience different than mine.
Right.
And when we're talking about pain, because pain is such a huge factor when it comes to this procedure, even within that, like, if you would have found me as a therapist 10 years ago, it would have been very simple. I would have told you to ice the knee. I would have said ice reduces inflammation. No, it doesn't. I would have told you that ice reduces swelling. No, it doesn't. I would have told you all of these things that I learned in school
Right.
as a good clinician. Now, with history and context and everything, I realized, wait a minute. No, ice actually doesn't reduce inflammation. Inflammation is a chemical. It's a chemical condition inside the knee. Maybe ice can reduce pain for some people because it gives you a different sensation.
Right.
But so much of what we've always taken for granted is based on mechanics. And I'm a kinesiology major as an undergrad. I love mechanics. I understand mechanics. You are not a mechanical system.
Mm-hmm.
You have mechanics, you have chemistry, you have emotions and feelings and context and fear. One night, if you look at the clinical research, one night of interrupted sleep increases sensitivity to pain. They took a group of medical students, they put them in a sleep lab for a week, and they interrupted their normal sleep patterns. All of them presented with increased pain sensitivity and symptoms associated with or similar to chronic pain conditions. They were foggy, they were confused, they were irritable, and they had more pain. And these were normal, healthy kids that were in med school, So we know that one night of interrupted sleep raises blood sugar levels. So even for a non-diabetic, their body has a stress response that raises blood sugar. So you can imagine a diabetic, it's going to be magnified. But it has nothing to do with eating too much sugar. It's because of the stress response of the procedure. So these are all factors that raise your anxiety, raise your fears like, oh, I can't control my blood sugar. What am I supposed to do? Well, this is why. It's okay. It'll be fine. It'll normalize. And I always say, like, my greatest value as a therapist isn't pushing your knee to bend. It's not straightening your knee. It's not telling you what exercises to do. The greatest value I can deliver to you, my patient, if you are my patient, is peace of mind.
Right.
Is to say, look, Russ, I've seen 300 other people in the last year who have had this procedure. Some did great, some did terrible. This is what they've all said consistently. And what you're telling me is totally normal.
Mm-hmm.
Like that, just having somebody that you can rely on and trust and know this guy is legit. This guy knows what he's talking about. I think that's a huge kind of like mental comforting,
Yeah. Well, that's good to hear, because nobody tells you any of this stuff. This is all like new stuff, as far as information is concerned to me, right? But I think you're right. There's a lot more to it. There's a lot more to it. It's too bad others don't do that. You know what's interesting though, with these YouTube things, many of us with the knee problems are little. We're upper in the age. Let's put it
right,
that way.
right.
Usually, let's say 60 and higher, and others have before that who've had problems with their knee. But the vast majority of us is probably over 60 years old, and we're not really that technology oriented. Many of the people I've heard from, and so for them to even seek out something on YouTube just to find it, it to me is amazing that they even find me, and then there's other resources like you're out there, and I think had I had found you during my problem time, I would have gone through this a lot easier.
Really?
I didn't find your channel until probably the last several months, really. And by that time, I'm, you know, I'd have gone through almost a whole year with
Wow.
my knee. So I'm hoping that, you know, through this interview is that at least my viewers will go to your channel and watch those things too, because you know, I can only give them certain information based on my experience, but I always preface it saying, I'm not a doctor, I'm not a physical therapist. It's that disclaimer, right? Because I
Yeah.
don't want to tell people things and I'm wrong. I'm always telling them, this is just my experience. Maybe I'm right, maybe I'm wrong, but this is what I've seen. And this is
Right.
what I think will be the case. But now they have a resource with you, okay, since they're connecting through me to get to you, right?
Yeah.
Um, they have another source that they can actually say, okay, Russ went through this. Maybe they can ask you, Russ did this. How's that going to work for me? You know,
Right.
so I'm glad that, you know, they're starting to use the technology to reach out and find ways to improve themselves, right? So I always feel good whenever my viewers say, you know, your videos help me.
Yeah.
That's what drives me to make another video.
Yeah.
If I was making this and nobody was watching it, then it's a personal diary and that's it. So there's
Right.
purpose in my life to basically say, okay, these videos help other people, and that's why I do it. And I feel too, even though it's your profession, you have that in your heart to help the other people too, and that's a big thing. So
Well,
thank
I think it's really interesting, when I look across my profession, and I'm the first one to admit, um, I don't work as a physical therapist to pay my bills and make a living. That's the reality. Like, I love what I do. I love being a physical therapist. I own the physical therapy clinic, and I've got, that from a financial perspective, but I treat patients because I love the experience of treating patients. And what's really interesting about YouTube and other platforms like this is the way technology has come so far, so fast. So I know you have used the Joint Active Systems
you.
device to work on knee flexion. They actually introduced me to you. I found you through them. And so one of the things that I've been doing on my side of the practice is, just like, insurance has a limit. There's only so much, that they'll pay for. And certainly healthcare costs in general are just inflated to crazy levels. But something that I always play with is I say, okay, well, I've got this individual who wants to continue working on her range of motion. I've shared some of her videos. She was willing to allow me to share her story, and we were using the Jazz device, which has been a great resource for us. And so it's interesting. Instead of her paying me, the exchange in value we had was, she allows me to document and share her story. I can share that on YouTube to help other people who maybe don't have access to this device and to information and knowledge, not just in the US. I mean, even just going across the world, it's crazy how many people have internet access and need this information.
Right.
And then the ad revenue that YouTube pays me for putting those ads in the beginning of the video that most of us just skip, that pays for the cost of me to treat this individual. And so, like, those are the things that get me so excited. And I spend half of my day treating patients, and I spend the other half of my day coaching and training other therapists to say, look, guys, we can do what we love, and we can fund that habit through other means.
Right.
And so I'm hoping to get other therapists out on YouTube, other therapists sharing their stories and the experiences and, their specialties, because the value is there, but it's hidden inside the four walls of the clinic. And unless we can get a video camera in there and share it with you, and unless we have patients like you, Russ, to share your perspective, I think we're doing a disservice to the population at large,
Right.
because they're the ones who need this information.
Yeah.
They're stuck in a cocoon, especially now with the pandemic.
Yeah. Let's talk a little bit about jazz.
Yeah.
Here's an interesting thing with jazz. Um, I had just started my YouTube channel not too long before I got my first jazz device. And so I said to the rep who came out to measure me, I says, you know, I'm going to do a review of your product.
Uh-huh.
I hope you like it.
Yeah.
So we did a review, and I guess that's how Jazz first got to hear about me.
Right.
And I guess they've been watching for a while. And then they said, you know, they said, we need somebody to test some of our products out and give us some feedback. And they were doing some changes to the product based on other patients mentioning and things that I've been mentioned too. And so they contacted me and they said, you know, would you be willing to use the unit again? I said, I can't afford it. I paid so much physical therapy. I can't afford it. And my insurance won't cover anymore. He says, what if we just let you use it? Don't worry about the cost. And in exchange, give us back some data, give us back some user feedback on how these changes are affecting you. And so they sent me a unit for the extension, and then eventually I asked them for another unit for the flexion, because they customized my extension unit, because you know that the unit does both extension and flexion.
Yeah.
But they said, we don't want you messing with that thing and turning it into a flexion one, because we made some changes specifically for you. So they sent me a second unit out for the flexion. So to be clear for the people who watch my channel, you know, some people think, oh, you're sponsored by them. I'm not technically sponsored. I don't have to say a single word about Jazz.
Right.
They've never asked me to say anything about them, but I, you know, I do talk about them a lot because I use it. I'm still
Yeah.
using it, and so I thank them for the things that they've given back to me, because when I stopped my physical therapy because of COVID-19 issues, not me, okay, the pandemic in general,
Yeah.
okay, um, my flexion dropped back down. I mean, I was doing 130 under pushing and 117 or so on my own, and I measured myself on the goniometer. I was getting 105.
Wow.
So I had reverted backwards. And I says, I need a flexion device. So they just sent it to me. And now I'm at 120 plus. I could do
Wow.
120 without the Jazz on me. I've checked it myself. And that was without any warm up, anything like that. So that's why I'm thinking I might be more than 120 if I was, you know, exercising a little bit first before I actually took the measurement and kind of
Yeah.
warmed myself up. So I think I'm actually over 120 at this point. And
How
that
are you measuring yourself?
it's interesting. That's hard to do, right? So here's what I do. I set up a tripod, and because I'm a photographer, I take a photo of my knee. I
Yeah.
take a photo from a distance, and then I put that photo on a large 27-inch monitor computer, and I put the goniometer on the photo.
Okay.
And by measuring that and aligning it with your hip bone, hip joint, and your ankle bone, and where the bend is, it's 120. So, but I have a problem with the extension measurement. I can't do that very well on my own. This is
Yeah.
why I keep saying I'm probably between 8 and 10, because I don't really know. I don't really know. I know
Right.
that I was 10 degrees when I left physical therapy, and I feel that my knee, since using the Jazz unit, is a little bit better. So I'm saying I'm probably between 8 and 10. That's why it's just a guess. Nobody's measured me. I can't measure it on my own.
Right.
So
Did you see the video I put out for people on how to do almost exactly what you just said?
no, I did not.
So I'll just give you the background and anybody watching. So basically, it's a video where I explain you can set up your phone, take a picture, try to get as close to profile as you can. Whereas you're putting it on a big, beautiful monitor, which is awesome. What I did was in the video, I embedded a link so that somebody could download. It's a protractor, which is basically a goniometer.
Right.
It's a PNG file with a transparent background. And so if you have any video editing software, you can put your picture, the protractor on top, arrange it over the knee, and you can get pretty darn good measurements. Now, as a therapist in the clinic for 20 years, I'm the first one to say my measurements are inconsistent. I'll have a 3 to 5 degree difference in extension or flexion any time of day with the same person on the same session.
Right.
So anybody watching, do not get hung up on the numbers. Function is all we care about.
Right.
Can you get off a couch when you're sitting and your butt sinks down? You know, can you get off the toilet? Can you go do the things that you want to do? Like that's the most important thing.
Right.
I always say nobody had their knee replaced, so they got 121 on a goniometer. They got their knee replaced so they can go hike and they can play with their dog and their grandkids. And that's what we want to focus on. The numbers are kind of, I don't measure range of motion every single session. I barely measure range of motion every month because I don't want my clients fixated on the numbers.
Right.
I want them to see functional improvement. And so that's really, I don't know how I got on that tangent, but I do think that's an important thing to think about.
Yeah, well, we have no other way of telling, but like I said, when I'm walking better than before I did the extension thing with Jazz. So
Yeah.
I know that it is better. When I'm in the shower and I look down, I says, yeah, it looks a little straighter to me, you know. So measurement or not, I feel it has improved, but
Right.
will I ever get to 0 degrees? And my gut feel is no, I don't think I will. My gut feel is if I'm lucky, I might hit 5 one day.
Yeah.
But realistically speaking, I know I will never be 100% back. I know that,
Right.
and I think there needs to be that acceptance. You have to kind of accept where you are, otherwise you won't be a happy person, right?
Yep.
So if you feel that, you know, it was better than the previous day, I think that's a win right there.
And you know, something you just triggered in my mind that is a conversation I have in the clinic a lot with individuals. Have you ever been in a situation where you're driving and all of a sudden traffic is backed up? Maybe you're driving down the highway and then you're stuck in traffic and you're sitting there and you're frustrated and angry and you're like, why is this going on? You know, what's up? And then 5 minutes down the road, you come across a car accident and you realize that it was a serious car accident and there's ambulance and fire trucks and potentially somebody was seriously hurt. And you have that moment of realization where you're like, that could have been me. If I would have left 5 minutes earlier, that could have been me in that car. So as much as I was frustrated because I was stuck at the back of the line, now I'm thankful that I'm not the one in the car accident. Have you ever had that experience?
Yeah, actually I have.
Think about that in terms of your knee for just a second. I was having this conversation with a lady that was limited. She couldn't even get to 90 degrees. She was so frustrated, did everything right. And so we sat there and we talked and I said, the truth is, I know you want more range of motion and you're pushing hard, but I also treat patients who have instability after a knee replacement. I also treat patients who have looseness, excessive looseness, and where our bodies cannot adapt to a loose knee, an unstable knee. The people who have that condition have full range of motion, but they also have instability. So they never know the next step. The knee could buckle and they could fall. That is a far worse issue and greater frustration than the person whose knee is too stiff.
Right.
You know, and so we have to look at that other perspective to say, well, maybe this is like this for a reason. And I'm the first one to say what I've learned through years, decades of physical therapy is stiffness is rarely a bad thing. When somebody has a spine problem in the neck or in the lumbar spine and they're stiff, it's frustrating. But the people who have real looseness and instability, those are the ones who have real concerns. That's where we're talking about possible paralysis. That's where we're talking about loss of control of your bowel and bladder. Like those are serious red flags. But a stiff joint, your body will stiffen to create stability automatically. And it's a natural reflex. It's a natural response in the body to instability. So, you know, if you're looking for the silver lining, I would say, well, at least thank goodness I'm not dealing with a loose knee that can't be tightened. I'm dealing with a stiff knee that will get loose, that will improve, just not on my time frame, not in 3 weeks, not in 12 weeks, maybe in 12 months or 36 months.
Yeah, there's definitely a long-term commitment to it, you know. And I never knew that either. I thought I'd be done in 2 to 3 months.
Yeah. Yeah.
Hey, anyways, I wanted to say thank you for being on the Russ is Right channel, and congratulations too for passing the 5,000 mark. And
Absolutely. Thank you. And
I hope
congratulations to you, because I think once this airs, we're going to see you over 1,000.
that I want to hit over 1,000. I want to be able to say that, yeah, there are people that watch my stuff. That's important for me, and I know that many have expressed to me that it's been helpful. So that's what drives me to keep doing it.
I
And
really think you're touching lives, and the information you're sharing, it doesn't matter. It's probably better that it's not from a therapist or a doctor, because it's from a real human being who's been living these experiences in real time. That's what people need. That's what I can't deliver. As much knowledge as I hope to achieve, I can never deliver the experience of being in that person's shoes like you can.
yeah, well, I may have to do it again on the right knee. That's a matter of time.
That's right.
They'll keep that channel going.
Yeah.
Well,
Maybe the
thank you
channel will pay
again
for the
so
next
much.
one.
I appreciate it. And for my viewers, go over to Tony's channel, take a look at it. I'll put a link in the description below, and definitely go visit that channel. I've been watching it for the last couple of months myself, and I mentioned that I would be telling you guys about other channels. Well, this is one that you have to watch. So
Well, I
thanks
appreciate
again.
it. Thanks so much for having me on, Russ.
Oh, no, my pleasure. We'll talk to you guys next time.
All right.